Today I am going to discuss briefly about the brain stroke. Brain stroke occurs when the blood supply to the certain part of the brain suddenly interrupts or stops either because of the blocked artery or ruptured blood vessel. Stroke occurs. Without the nutrients and oxygen from the blood, the brain cells cannot function properly and eventually die. This causes the brain stroke. The types of the brain stroke include ischemic stroke and hemorrhagic stroke. Ischemic stroke occurs when the blood supply through the blood vessel will not occur, either could be because of the blocked artery or narrowing of the blood vessel or any small blood clot which obstruct the blood supply to the certain parts of the brain. Ischemic stroke occurs when the blood clot occurs locally or when the blood clots travels elsewhere from the body. Locally, blood clots forms when the fibrous fatty plaques ruptures or cholesterol plaques ruptures, and it will give rise to the clot formations and it will blocks the artery that leads to the ischemic stroke. On the other hand, hemorrhagic stroke occurs when the blood vessels leaks or ruptures. Hemorrhagic stroke occurs. It occurs because of high blood pressure or overuse of the antiplatelet drugs or overuse of the anticoagulant drugs. Sometimes abnormal formation of the blood vessels such as aneurysms and heavy malformations rupture leads to the hemorrhagic stroke. The symptoms of the stroke include deviation of the mouth to either side, difficulty in speech or difficulty in understanding the speech, weakness of the one hand, that is difficulty in lifting the hand, or weakness of the leg, difficulty in walking, or sometimes associated with the swaying to either side while walking. Sometimes stroke symptoms also associated with headache, vomitings, dizziness, seizures, with loss of consciousness, sometimes with coma. Most important point in the brain stroke is to get the patient early within the window period, that is 4.5 hours. If we do IV thrombolysis, patient will recover immediately.